Good morning or good afternoon, depending on where you are. I'm honored to be a part of these important conversations alongside friends and colleagues in this work today. I'm Moki Macias, and I serve as the Executive Director of the Policing Alternatives and Diversion Initiative in Atlanta, more affectionately known as PAD. I'd like to start out my comments just by acknowledging that it's fitting this gathering is happening at the start of Black History Month. How policing has evolved in our country is deeply tied to how laws have been enacted and enforced in relation to Black communities. We wouldn't be here talking about alternatives to police if it were not for a national Black-led movement which demanded a reckoning with this painful truth. With that in mind, I'd like to offer some thoughts on how alternate responses can help our communities change course. I will also speak to how a narrow focus on clinical response to mental health emergencies might undermine the transformative potential of this moment. And I'll also touch on our collective opportunity to invite community members to redefine public safety by requesting a care-based response instead of a punitive one. So the Policing Alternatives and Diversion Initiative, or PAD, resulted from community organizing in 2015 to reduce and arrests and incarcerations of people experiencing mental health concerns, problematic substance use, or extreme poverty in our community. The campaign and the visioning that resulted from it was led by Black, trans, and queer organizers who highlighted the experience of frequent police encounters on the one hand and inaccessible community resources on the other. So with support from our county and municipal governments, in 2017, PAD launched mobile response teams to provide an alternative to arrest for people who are detained by police. Based on the LEAD model out of Seattle, PAD teams meet police officers at the scene to divert people pre-arrest and offer both direct resources like respite housing and transportation assistance and longer-term navigation to community resources. In 2021, we began accepting community referrals in partnership with the City of Atlanta's 311 non-emergency services line. So now community members can call 311 to request assistance responding to quality of life concerns. 311 agents will take those calls and submit the request to PAD for in-person response. Again, our two-person response team, similar to how we respond to law enforcement diversions, will go out to the scene, we'll attempt to find and engage the person who was referred, and then we'll offer both immediate resources and connections to other community supports. We prioritize situations that may escalate to police involvement if not addressed. And then we follow up with callers who provide their contact information to 311. When we follow up with callers, we often find ourselves in conversation about why they chose to call 311 instead of 911, how they hope the situation would be resolved, and also questions about what community resources exist for the issue that they called about. Every call that we recruit from a police response reduces police interaction and the consequences associated with it. But we know that we're up against deep-seated assumptions, biases, and cultural narratives that influence when someone calls for enforcement versus care. When is a person perceived as a threat instead of someone who needs help? When is agitation, for example, perceived as aggression? And when is it perceived as vulnerability? We know that race, age, gender, and other identities influence these perceptions greatly. In order to help our communities change course, we need to name these assumptions and we need to advance new narratives, right? Through messaging, through communications, and through our community engagement strategies. So I want to talk a little bit about our design process for establishing this partnership with 311. To develop the protocol that we use with 311 to provide community responders for these kind of concerns, we engaged in a 6-month design process of community surveys, virtual listening sessions, which were co-hosted by community organizations, and working group meetings with system stakeholders and with advocates. We also analyzed several years of 911 call for service data, and I want to talk a little bit about that. What we found in the analysis of the 911 call for service for our city was consistent with other cities around the country. The vast majority of calls that are made to 911 were for non-emergency concerns. About 20% of these calls, or 600,000 over a 3-year period, these were for codes that often we know are related to mental health challenges, substance use, homelessness, survival activities, right? We looked at that subset of calls, that 20%, and we found that for that subset, 40% of those calls came in through the 7-digit non-emergency police line. So people are picking up the phone, they're calling the non-emergency number. However, in our city, as in many others, that number actually rolls straight into the 911 call center. What we also found was that about 93% of those calls were assigned a 20 to 50-minute response time by the 911 telecommunicator. And so for us, this suggested that in many instances, both the callers and the call takers had identified the concern as one that needed a response, but not necessarily the emergency response that 911 is designed for. From our community survey and listening sessions, we learned the kinds of concerns people wanted assistance with, what they would like to call 311 for instead of 911. And we also got into kind of the stickier questions of consent, of police involvement, and other critical elements of this protocol to really hear from community members about what would work best for them, what they were worried about, and what they needed from a different response. So currently we respond to concerns in 7 call categories: disturbance, public indecency, welfare, basic needs, public health, mental health, and substance use. These calls are fielded when they come into 311 by a dedicated supportive services delivery team, which the city has invested in to support responding in person to these kinds of non-emergency concerns. We're also in planning conversations with 911 and 311 about actually transferring some of these call codes from 911 into the 311 system, and also to develop joint public education campaigns about when it's appropriate to call 311 based on the services available in our community, and when they should be calling 911 based on what we currently have available. One of the most frequent questions that we receive when we are sharing about what we do to community members is whether our teams respond to mental health concerns, and particularly to mental health crises. I think this is an interesting question, because what people are usually asking is, it's really about what our team has the authority to do rather than the experience of the person we're talking about, right? So our teams respond to many situations where a person is distraught, overwhelmed, they're extremely hungry, extremely cold, scared. That's not usually what people mean when they say crisis, right? What they mean are emergencies that require psychiatric care. And I think we all, it is common that we use the idea of a mental health crisis as a shorthand for that definition, right? And what they are often getting at is, will we remove people to the hospital? I think it feels easier to replace police who can remove people to jail with clinicians who can remove people to other institutions, even if that is not what happens much of the time, right? In our community, the focus of mobile crisis response is almost entirely on clinical assessment for psychiatric intervention. This limits the team's abilities to holistically address the needs that often result in police involvement down the line. In Georgia, our statewide crisis access line provides 24/7 telephonic support to people in crisis and has the ability to then dispatch a mobile crisis team, right? It's very similar to what will be launched in every state this July to support the federally mandated 988 number, which I know we've heard some discussion on in the last day. There's a couple challenges that I would like to just point out or to raise as a part of this discussion. One challenge is that the model that we currently have relies on the fact that people are calling either for themselves, for a loved one, or at least for somebody that they have substantial information about. Calls to 911, in contrast, are often made by strangers who are calling about people that they don't know. So the existing model of conducting a telephone assessment prior to dispatching doesn't actually make it a viable option for many scenarios that do, in fact, typically get police response, right? When people call 911, they may not have a lot of information, but they do expect an in-person response, right? If 988 is to serve as an alternative to 911, I believe that it would need to be able to dispatch a non-police response team to conduct outreach to the person involved and to offer the appropriate assistance. Right? I'd like to highlight another challenge that I think has implications for alternate response. So as folks are likely aware, the National Suicide Prevention Lifeline, which is run by Vibrant Health, was awarded the 988 implementation contract nationwide. This lifeline, like many other crisis hotlines, routinely tracks location information and sends police response without the knowledge or consent of the caller until the police arrive. Although many hope that 988 can replace 911 for mental health emergencies, precisely to avoid police involvement, with the current practices, it's not clear how it'll do that. Without decoupling crisis lines from police, the communities that have been most harmed by our current response system will continue to be harmed or underserved. In Atlanta, we try to be very transparent about how we interact with the police department so that community members can make informed decisions about requesting assistance. We work very closely with the police department if they are already involved in a situation and they're requesting our presence to divert someone from jail. Right? However, for community referrals or our outreach activities, we operate independently from law enforcement altogether. So when community members call 311, the 311 call taker does have the ability to warm transfer to 911 if they identify a medical emergency or a police issue. But we work very closely with the 311 operators. They are cross-trained with 911. They are cross-trained with our teams. To really look at what are those situations in which they should transfer it back to 911 and to give people the option, right? To not just automatically transfer, but to say, this is actually not a call that we can address, but I can offer to transfer you back to 911. So that's something that, we will talk, we meet as a team with the 311 agents and our referral coordinators to every week we debrief calls. We talk about calls that seemed a little sticky or that people had questions about. And it really gives us an opportunity to check in consistently about how often that is being used, about what clarity may be needed on the part of the call takers, or what clarity can we provide in terms of how CAD can respond to calls. That just continues to be very transparent and very intentional about when calls would be transferred back into the 911 system if that was appropriate. But when a referral is designated for PAD and comes to our team, that's solely our team responding, and we really take it from there. If during a diversion or a community referral, we come to the point where we recognize that a person is truly unable to keep themselves safe and we've exhausted our other options, we will engage our local mobile crisis team. They are absolutely a partner to us in those kinds of situations. When we do, we stay on the scene, we offer support throughout the process. We will accompany the person to the hospital if that is what ends up happening, and we'll provide information to hospital staff so that we can disconnect with that individual at discharge if they are interested. We're very early in the development of this model. We're constantly learning from the work of many, both locally and across the country. But I think what our approach has to offer is that we started from the other end of the spectrum than many communities. So instead of focusing on providing alternate response to mental health emergencies and other acute situations, we focus on responding to those concerns that most consistently lead to arrest and incarceration for people who may be struggling with substance use, who may have unmet mental health needs, or are navigating extreme poverty. I think the value of this approach is that we are enlisting community members in the work of transforming our system level responses. We ask people to consider what resources actually needed, and then for them to vote with their fingers, right? To request a care-focused response instead of an enforcement-focused one by calling the non-emergency services line instead of the emergency services line. I think we have an opportunity collectively to redefine public safety. Public safety does not have to mean punishing people who are trying to survive. It can mean caring for the safety and well-being of the people who have been the most harmed and marginalized by our systems. This is what we believe, will ultimately improve our communities and increase safety for all of us, right? And that, to me, is really the promise of alternatives to policing. So I just wanted to, share a little bit with y'all today about the perspective that we bring to this work, about the experiment that we are engaged in Atlanta, and I'm really looking forward to the rest of the conversation. Thanks.
Well, thank you, Moki. Thank you for that presentation. Really wonderful to hear from you and from Atlanta about your program. Again, I'm Jason Renault. I'm the program manager of the conference, and we're just going to do a 30-minute or so question and answer session and ask some questions that I heard or came to me from your talk, and also take questions that are written in the chat. So if people who are watching now live and put their question in the chat, I'll restate that for you, Moki, and we'll see if we can get through some of these. So tell me a little bit about the origin of the program and how it came to be and how it got framed within the context of the LGBTQ community.
Sure. Yeah, thank you for asking. So in 2014 or so, we started getting news that in a few of the neighborhoods in Atlanta, there was a proposal that was going to come before our city council to banish people who were from the city limits, who were engaged in survival sex work. And so, that was of great concern to many community members that would be the response. And I think there was particularly a focus in our Midtown community where trans women, Black trans women in particular, were being sort of targeted for enforcement. And, there was kind of a neighborhood vigilante type of approach that was really targeting women who were potentially engaging in survival sex work or were simply walking down the street and assumed to be. And for folks that, very often were not able to access traditional shelters. We're not able to, we're encountering severe employment discrimination. We're encountering severe threats of violence and experiences of violence, right? And so that really kicked off a conversation amongst organizers and activists and other community members in Atlanta about what really could be done. And so that kind of came together as the Solutions Not Punishment Coalition, and really focused on addressing the immediate needs of folks that were surviving on the street and recognizing that although police officers were under incredible pressure to literally make people disappear, right, and then banish them, we knew that there was another way, right? And so that there was just a beautiful coalition developed with leadership from trans and queer community members in particular, who were really leading the charge to say, we can be better than this, Atlanta. We can do something different. And if it means we need to start with law enforcement because they are often the people who show up first, or the people who are called upon to make to make something happen, then we can do that. And we can do that in a really practical way.
The mental health community can learn a lot from both the African-American civil rights movement and the civil rights movement community organizing that happened with the LGBTQ community in the 80s and the 90s. Boy, what a powerful source of allyship. I'm glad that happened for you, and I'm glad it's still growing. So you talked quite a bit about 311, and how did that relationship begin? Was that in place when you started, or did that grow over time?
Sure. Was the City of Atlanta 311 line?
Or your relationship with 311? Did PAD start with that, or?
Sure. Yeah. Thank you for that. So, I think the way we developed really shaped what the partnership ended up looking like, or is, continuing to evolve into with 311. Our North Star has been to reduce arrest and incarceration for people experiencing mental health concerns, substance use, or navigating extreme poverty. And so when we started talking about a community response that did not involve police, we had already been out on the street for several years responding to these kinds of concerns, right? And so, we would receive questions within the neighborhood meetings that we went to, within any of the community engagement that we did, where, inevitably at least one person would ask, well, what you do sounds great, but how can we reach you if not for the police? And so that has that was sort of part of our trajectory throughout our development, was just thinking about that issue, right? That, and I think we see that in many diversion programs around the country, right? That people say, oh, well, this is great that you do this work, but it shouldn't be contingent on police involvement nor police discretion, right? And so as we started exploring what it would look like for us to respond directly to community member referrals, I think what was very important to us was to stay connected to the public system, right? Because we believe that an alternate response should be baked in to our institutions, right? It should not necessarily be limited to independent organizations offering that service. Now, I think it's important that we have a multiplicity of resources for community members to choose from, but that it is very important for our public systems to offer responses that are beyond punitive or enforcement response, right? So 311 in that way was sort of a natural option for us. We did not have the capacity to start our own call center. We did not have the interest in creating our own independent number. And yet we had a great potential partner in our city non-emergency services line, right? That it was sort of an easy fit, in fact, because so many community members are used to calling 311 to find out when their court date is, to figure out their water bill, for a whole variety of concerns, that it made sense to evolve what the city is able to respond to in that direction.
Yeah, it's really helpful to hear you describe a little bit more about 311, since much of America doesn't have that yet. And we're on our way to somehow being incorporated into 988. We're being told in a matter of weeks. This is going to be a big transition. Do you have any comments on that at this point?
Yeah, I think it's really important that people have other resources to call, right? That because of the way that 911 has evolved and has defaulted to an enforcement response, and because of the way communities have been harmed by that default to enforcement and punishment, there's a lot of distrust, right? Amongst communities of color, amongst immigrant communities, for folks who are dealing with intellectual disability or other different abilities. So there's a lot of distrust there with 911. I think there's a real opportunity to create a system where people can choose an option that does not include the threat, frankly, of police involvement. Unfortunately, at this point, I don't believe that 988 has solved that issue. I think there is a real question and there a real opportunity right now to help make sure that this system becomes the alternative that it actually has the potential to be. But we have to resolve the issue of whether an alternate line like 988 will continue to, without people's consent, direct police response. So I think that's the nut to crack. I think that all of us should be paying very close attention to that issue and try to do whatever we can to ensure that when people call an alternate line like 988, they get what they're looking for.
Could you walk us through a day in the life of as the PAD team is out on the streets and meeting and greeting?
Sure. Yes, I'd love to. And if anybody wants to come to Atlanta, you can actually just, come hang out with us for a bit. So you're welcome.
I'm going to do that.
Yeah. So yeah, I'll start with, a call comes into 311. Let's say somebody, a business owner calls or manager of a business. They say, I came here to open my shop and there's a person who has, been sleeping in the doorway here. It looks like they are pretty distraught. I've asked them to leave, but, they aren't able to leave right now. I don't want, this to escalate, but I really need to be able to open my store and have, be ready for business, right? I don't want to call 911, but can you send somebody? At that point, the 311 operator will get a bit more additional information, make sure they understand where the location is, just get the kind of basic information that they need. And then when they've assessed that it's a good fit for PAD, which, this is kind of like a perfect example of something you want to respond to, they will send that request over to our referral coordinators. Our referral coordinators will then figure out which team that, we can dispatch. We also look at what is a pretty urgent request versus what is something that we can schedule an outreach team for, right? So, for example, if somebody calls and says, there's a gentleman who's been living behind my apartment building, he's starting to get more and more stuff. I'm worried about his well-being. That might be something we can call the community member back and say, hey, is he usually there in the mornings? Is he usually there in the evenings? That will be an outreach request, and we'll go out in the next couple of days, right? Back to our original example, if that business owner is, about to open their business and there's a potential for police involvement, that's something that we'd really prioritize. So our referral coordinators are saying, okay, this is an immediate request. We need to get our team out. They're going to figure out which team is available. Our 2-person harm reduction specialist team will then hop in one of our vans. We've got vans, they're sort of like van taxi cabs. They've got the plexiglass barrier in between, both for COVID safety and also just to provide a little bit more sense of, a little formality to the experience if they're transporting somebody. But they show up, they're going out in PAD gear. So similar to Cahoots, we wear t-shirts, we'll wear sweatshirts, we have caps, but the teams are not in any sort of real formal uniform. And this should go without saying, but they don't carry any weapons of any sort. Whatsoever. So the team will go out and they'll start a conversation. We're a consent-based outreach program, right? We are not there to enforce the law. We're not there to compel anybody to do anything that they don't want to do, but we can offer any immediate resource that would be useful. Oh, I see you're not wearing shoes today. It's getting pretty cold out. Or have you had something to eat this morning? Right. So they're going to engage them just in that kind of conversation. And they're going to be transparent with them of, it looks like the business owner, is concerned about you being here. We're worried that, that we don't want the police called on you. We'd love to help you figure out, a better place for you to be. We will offer transportation. We will, offer food, clothing, and then, for folks, often the folks that we are working with are experiencing homelessness. And so we will do our very best to offer them either direct respite housing or to connect them to our continuum of care and shelter partners. So I want to say a note about this that, there's folks that we engage with that need a substantial amount of support. What we are doing currently is that if they also have open cases in our jurisdiction, so open criminal cases, we are able to then also enroll them into our kind of diversion side of our work. So that's our care navigation. That's connecting them with, what we call care navigators, similar to case managers, folks who will build a longer term relationship with them, provide those direct services and help them navigate, and oftentimes that's a relationship of, it may be 3 or 4 months, it may be several years. We have folks that we've been working with for several years. It is difficult for our team, just capacity wise, to extend that kind of longer term care navigation to every person that we're responding to on the street, right? But we are doing our very best to try and make sure that that's a consistent offer for folks, particularly if there's already a prior intersection with the criminal legal system.
I have a question from the chat about threat escalation. When you find someone that is in imminent danger, how do you raise that concern up in the chain of services?
Sure. So, for our teams, what we focus on, we certainly focus on de-escalation where appropriate. And the priority for our teams is like, if a situation is going a little sideways, the most important thing is to remove yourself from that situation. Because we are not there to compel anybody to do something. If somebody is letting us know loud and clear that they don't want to engage with us, we are going to remove ourselves from the situation. If it is something, if something happens where we feel like somebody is about to be, seriously hurt, or where there are other issues present that require a medical response or possibly a police response, we will engage 911 to be able to do that. When that happens, we are going to stay safely on the scene, and our teams will, as much as possible, interact with emergency responders to provide them context. Because we work closely with the police department in the diversion space, we also have strong relationships with zone commanders, right? And so when we know something's happening in a particular area, and we know that police are going to be called to that scene, maybe that a neighbor has called or the like, we will proactively reach out to the zone leadership to say, hey, listen, like we have a little context on this situation. If we can support, let us know. If you are involved and are willing to make a diversion, once something, has calmed down a bit, we're happy to do that. So we just try and stay in communication, and throughout, our goal is one, is to keep our team safe and to use our best judgment, but also to be advocates for the person in question, the person who, is the focus of that kind of response.
So if a person is a danger to themselves or others, you're going to move that call up but remain a witness and an assistant to make sure that that situation doesn't get more out of hand than it needs to.
Yeah, and there are situations where, particularly, where we call for our mobile crisis team support, and we stay involved in that whole process. It's not ideal, it's not something that we take lightly, particularly if it results in involuntary transport for assessment. That can be a very traumatic experience for community members. And so we try and take that very seriously, but we stay as involved as we possibly can throughout the process.
Just jumping around, you mentioned housing a minute ago, and you noted homelessness is a constant problem. How do you go about making the connection to respite housing or shelter housing for folks? And how do you go about talking to people about getting access to that? By people, I mean people you're meeting as clients.
Yeah. So, as part of our diversion work, we have, from our inception, we have offered immediate housing in our first interaction. And that is built into our operating budget that, we have, close to $1 million of our operating budget is actually dedicated to simply providing those services. And I will, hats off to the folks in Seattle for that. I think we were, from the very beginning, they said the most, you have to fight for that. You have to fight for the ability to provide direct resources, because the reason we are in the situation we are in is because there is not enough resources, right, to meet people's basic needs. And often what does exist has very high barriers, or there's other reasons that people are not able to access them. And so it's important for us to be able to say, yes, you can, we can help you have a bed to sleep in tonight. In a place that feels safe to you and comfortable. And so we use a hoteling strategy for many of the folks that we connect with. So we are able to offer them emergency hotel stays for, we try and stick to a week. Often that it gets extended just because of the situations. And, we try and develop sort of person-centered plans so that, that can kind of look different for each person. That said, it is a very, it's expensive to do that work. And it can get a little tricky if you folks are, we're connecting with folks on the street and they're like, oh yeah, you're the people who can get us a hotel room, And so we try and be, we try and be as creative as possible in what we can connect people to. And that is something that we are up against as we're doing more and more community responses. We just don't have the capacity to directly provide for a shelter or a respite housing resource for every person we meet. But we are in conversation with our housing partners across the city and with our city and county leadership to say, if we know that the solution to homelessness is housing. And so we need to continue to see investments in immediate, places where people can immediately have a safe place to lay their head. And often that's, non-congregate, that's low barrier, it's housing first based. Those are resources that we don't have enough of in our community. And so we have to advocate system-wide for that as well.
It seems so important that we meet the person on the street and their acute crisis is, say, psychiatric, but the chronic crisis is services and the lack thereof. It's amazing that you have that resource, and so important to think about that housing is an essential component here. Do you, shifting again, we talked a lot yesterday about Eugene, and we heard a lot about Eugene's Cahoots program. Atlanta is a big city. Eugene, you can walk across town in half an hour. Tell us a little bit about the issues that you find that just are presented by your city and the geography of a very large population.
Yeah, thank you for that question. And I will just say, shout out to Cahoots and the lovely, awesome people over there. Ebony and Laurel in particular have been just a wonderful resource to us as we've thought through some of these issues. And I just really, really, we all here at PAD really respect and admire the work that they're doing. The thing that I think is at the heart of what Cahoots does and what we keep at the heart of what we do is just a real deep respect for the people that we're working with, and a recognition that the most important thing is building those relationships, and that's just sort of unconditional positive regard. So shout out to Cahoots. I will say, I think that people, I got some responses when we initially started talking about doing community response and going citywide, where people were like, that is going to be too much too soon. Atlanta is not only a fairly large city, but it is very geographically spread out. But what I've found, I think, what our experience so far has attested to is that the geographic expansion is a little bit less important, in that it's really about people knowing that it's available, right? That's what really dictates our volume, right? So we are currently available citywide, but in fact, most people in the city still don't know that we exist. They still don't know they can call 311 and they can receive this kind of response, right? And that was intentional for us in the first year, is to say, let's offer our response geographically, quickly, right? Like, geography wide for the city, but let's be a little quiet about it. Right. So that we can get our feet under us, and so that we could just figure out what it looks like with 311 and work out some of those issues. So this year, we're really doing more public engagement around this option. We're going to be doing, like I said, much more sort of external communications about it and education with community members. But I think we are also having to ask people for grace who call us, because there are times where our teams can show up very quickly. There are other times where it's harder for us to do. And we're a very small team. We've got 6 teams that respond. 5 of those are available for immediate response to law enforcement and to community referrals. And then we have 1 outreach team that is going out to scheduled outreach and also just doing proactive outreach and supporting the other teams. So, I think we're going to see that as people request our response through 311, that we're going to really have to increase those teams and just our capacity overall. Right now, I will say our average response time for requests that we deem as immediate is about 17 minutes.
That's really fast, considering if you've driven around in Atlanta. So Clara in the chat is answering some questions about the budget for PAD. But could you tell me, you've scaled up a lot just in the last year, and you have plans to scale up more. How do you approach that as a director of a program? The idea of not only, building the team, but also managing those external expectations.
Mm-hmm. Yeah, thank you for that. So I think that there was this, critical moment, this window of opportunity that was really created by the national movement for Black lives and the call to change our relationship as a society with policing. And so in summer of 2020, we started developing this response, this partnership with 311. So it felt important to take, to really take advantage of that opening politically and do something quickly, knowing that it was going to be a big push to scale that fast, but that it was going to, once we started down this path, that we would be able to build on the public confidence and the public interest that we felt we could generate. And I think that's what happened. I think we were able to initially receive additional funding through our city to be able to expand, and then we've had to really backfill that with private philanthropic support. Again, I think because of the moment we're in, we have been able to attract support from national and local foundations, but ultimately this should be publicly funded, and we know that. Right. Our goal is that 80% of our budget is publicly funded. And what we see on the local level, it's like the county, it feels most appropriate for the county to fund our direct services, our care navigation, our direct housing support, food support, all of those things. On the city side, and there's some infrastructure for counties to do that, right? Because they already do that. On the city side, response tends to be, 95% of that is directed towards the police department. And although it is the city's sort of responsibility to provide a response to their constituents, there isn't a lot of other infrastructure to support responses that are not police. And that's really the conversation that we're in right now with our new mayoral administration, with our city council, about how we can structure the funding that comes from the city to support these kinds of responses. And I know we'll be hearing from Mariela in Albuquerque, with the approach that they took to really bring it all in-house. I think in Atlanta, what we're pursuing is more of a public-private partnership so that there is a sort of departmental home, if you will, that there is a clear dedicated funding stream for these kind of responses, but that then there could be a multiplicity of organizations that are actually responding to those, to those concerns. We're not invested in being like the be all end all in Atlanta. There are other organizations that we think are well positioned to respond to various other, concerns. If we have a way for public dollars to get to those organizations that have the strengths to be able to do that, I think that'll take us a lot farther in being able to sustain and expand these kinds of programs.
Question from the chat a little bit earlier is about your community outreach and your public education. What are you doing to engage neighbors and neighborhoods and also partners such as housers and hospitals in your work?
Awesome. I love that question. So community engagement has been really important in both designing what we're doing and then also educating community members. What we want are people who are championing the option of another response within their own communities, right? That are ambassadors for changing how we respond as a society, without us needing to be the only ones standing out there saying, hey, we should do this, right? And I think there's a lot of public will for it. People want to do that. People are reaching out to us all the time saying, I believe in this. How can I educate my neighbors? How can I support? And so, for example, we have a resident who works in our local public safety net hospital. And he was doing peer training within the hospital with his colleagues about, this kind of response and how the hospital could support it. In terms of our proactive community engagement, we certainly, we attend a lot of community meetings, we attend a lot of community events. We have partnered with other organizations that have aligned interests to do door knocking. Our outreach team, as well as our harm reduction specialists, when they are not responding to calls, are going out and proactively knocking on doors as well. But mostly concentrate on business districts, but I think there is real potential for us to do more sort of residential outreach as well. But really, the idea is just going out there and talking to people and saying, do you call the police for these issues, or do you not call the police for these issues because you don't think it's the appropriate response? We really think we can get to kind of the spectrum of people that would support this kind of response, right? People who are fed up with calling police, people who would never do so because they're concerned about the response. So I think, that piece, like, we're really trying to get into those conversations with people. And we're working now actually on yard signs, on bumper stickers, on window decals for businesses that basically say, our tagline, which is that a new approach to community safety and wellness. So we're trying to build a sort of public momentum and awareness, which is really important. I do want to add one other thing. What I didn't necessarily anticipate would be very important, but which has become, is our conversations with callers in the follow-up. So like I mentioned, if a caller provides their callback information to 311, that comes along to us. Once our team has gone out, once we've, done what we could do, the referral coordinators will call that caller back. And that community engagement, those conversations, and we're very careful of protecting the privacy of the person that we may be working with. We're not giving them, detailed information. But we're really, for the most part, we're having these conversations with people about what their concerns are, about what they want to see happen. We're helping them understand the context of what they have just, called about. And I think that on some level has been the best kind of community engagement that we can do, because they're people who are looking for us, and they're people who are willing to then have those conversations with their neighbors.
Great. I want to say Clara is really rocking it in the chat. She's answering about half the questions we're getting, and much better than I'm sure we could. So thank you, Clara. That's very helpful. So yesterday, Ebony Morgan of Cahoots sort of boiled down what she was looking for in a new team member was that they be charmingly assertive. This, I think, is a new technical term we've just coined, charmingly assertive. And what's your strategy? You've got a workforce problem all across the country. What's your strategy for recruitment and retention?
Yeah, thank you for that question. And I love that from Ebony. I really, I couldn't agree more. I think the emphasis on that we are looking for people who have a deep commitment to this, to just working with other human beings with grace and respect and patience, I think is really the core of it, right? Which is not to discount the sort of street skills that people need and that they also develop on the job, and that they often come in with from years of experience within behavioral health. For us, generally, folks are coming in with experience within behavioral health settings. That's all of that is really important. But if somebody does not have a heart for the work, then it's pretty clear that they're not going to be a good fit for PAD. I will say, it has been challenging. It's been, definitely challenging to find folks that have that sort of like perfect blend of skills and experiences. But I think the more that we can follow Kahoot's example in terms of really focusing on training people up and giving them real support to really integrate what they're experiencing and what they know. I think that is really the best possible approach, that it's really just making sure that, if we can find folks who have enough understanding of the circumstances that people often find themselves in and have a heart for the work, as long as we can give them that kind of robust support as they do this hard work, I think that that's really what is going to make us successful. And I will say, we have a lot to go on that. I will be honest that, oftentimes it feels like we are, folks are getting hired and we just throw them right in there. We do it. We try and ensure that we're pairing people appropriately. Folks are never out in by themselves. Right now, we're starting on our care navigation side, a process where, there is a mentor assigned to a new hire for a 3-month period. And so they're really kind of being their peer coach along the way as they're getting them into their work and helping them debrief challenging situations and that sort of thing. But I think that's really what it is. It's just giving support to the people who are showing up every day and saying, yeah, I want to be a part of doing something radically different than what has been offered before, because I have a deep love for human beings and a deep desire to help them expand their options.
How much is lived experience criteria? And I mean that also by, say, veterans speaking to veterans, people of color speaking to people of color, people with psychiatric recovery speaking to other people in psychiatric crisis. How important is lived experience in your scheme?
Yeah, I think it's very important. It is certainly a part of what we look for in every position that we hire for. We have not created it as, we are actually just this year, for the first time, hiring dedicated certified peer support specialists for that particular role. But it is absolutely embedded into what we look for across the board. And what we find is that, because of the ways that we talk about our work and the ways that we invite people to be a part of it, within the interview process, we're really getting at the why, what our North Star is and our values. And what I think, is a strength for us is that it attracts folks that care about this work, often because their personal experiences, right? Like the people who are wanting to do this work are often the people who have navigated these systems for themselves, who have, who have their own story of recovery, who have family members who have been harmed by police violence, who have family members who have, they have supported throughout these systems. I mean, that is a key feature of most of our staff members, that there is a real there's a real personal connection there, even if they have not been sort of certified as a peer, right? I will also just shout out the Georgia Mental Health Consumer Network and the Georgia Council on Substance Abuse, both organizations that have incredible programs to support and train peers, and who we're really excited about continuing to partner with in this work, because they really lift up not only the peer workforce, but also the value of peers actually shaping the work.
It seems that's part of the peer experience, is that being able to do this kind of work is in itself some of the compensation. And so, but what about the other sort of the compensation? Just back to the budget and the nuts and bolts. Are you able to offer, and to retain people, are you able to offer a living wage at this point?
So our wages are, I would say, fairly competitive for folks that are coming in at the, to do the harm reduction response or care navigation. So it's, 48, and this is Georgia, but $48,000 a year sort of baseline up to mid 50s. I think that is, I second, the concern that was shared yesterday that, just people are underpaid generally in this field so much that, we continue to push to increase that budget. And also, honestly, as an organization that is attempting to, to do justice work, also that we don't have a huge gap between the person who is paid the least in the organization and the person who is paid the most, right? So for myself as executive director, I'm making under $90,000 a year, right? So there's a smaller gap there than what we usually see. The other thing I will note is that we really, really, really want to create an organization that takes care of where we take care of each other, right? In terms of our policies, in terms of how we are embodying our values, in how we work with each other and with staff members, right? We offer very good, I think, benefits generally. A big part of that is ensuring that people have time off. So, that folks are really, really encouraged to take their vacations, to take their PTO time. We close the office for half the office for a week in the summer and a week in the winter. And so we're really kind of forcing folks, because oftentimes people in behavioral health, I have come to learn, although that is not the field I came out of, they don't stop, they're really, really driven, and sometimes have to sort of be gently forced to actually go ahead and take a week off and do that reset and really, and do that self-care.
This is a spectacularly difficult work, and we always see people having issues around trauma from the work itself. And so that's great to hear that you're setting up and understanding that those protections need to be in place from the organizational level, and not just the individual figuring it out for themselves. I have a question from earlier in the chat. Back to the tactics on the street. How I'm sure you see people who are in deep denial and confusion about their situation. When someone's really being destructive to, say, their home or to their surroundings and to themselves, how do you? What are the tactics that you use to break through that denial?
Mm-hmm. Well, I'll say I'm probably not the best person on our team to answer the question. I would love if one of our harm reduction specialists was here to really be able to speak to that. But it can be a challenge, I think, because we very much want people to receive the support that we feel they need. And we very much want to make sure that the situation does not escalate to where they end up in handcuffs in the back of a police car. And so I think it can be challenging to reconcile how much we want that person, to be well and okay, with having to really respect their self-determination and really respect their choice. And so, in situations where it feels like, they are continuing to make a choice that puts them in a vulnerable position, we will continue to try and engage them. This is less related to like immediate issue of physical harm, but more related to, say, somebody who doesn't want to leave the sidewalk that they're on. They're maybe using the bathroom there. They maybe have all their stuff with them. We know that police are likely going to be called if they don't decide to leave, but it's not for us to decide, and so we will do our very best to have those conversations with them. I think motivational interviewing is a really important skill that we use, like many other teams doing this work. We also just try and be very I love the idea of charismatically assertive, right? That we try and be really honest with people about what the other possibilities are, the risks are, and then we keep showing up as much as we can. So we will, if somebody doesn't want to engage with us, but they're like, yeah, I'll take some water. It's like, okay, well, do you mind? Can we come back over tomorrow and just check in on you, see how you're doing? Next day, our team will go back out. Sometimes we find that one team will go out and it's just not a good fit, right? For whatever reason, we try and be really conscious of just our own social positionality too, that, there may be somebody who says no, I'm not talking to men. I don't want to talk to some dude, right? But if our other team members go out, that person might be willing. They might say, okay, you're not a tall man coming to talk to me. Okay, I'm going to give you the time of day, right? So we try and also just play to our strengths, and try and be really persistent with people really holding that line of, if somebody is telling us this is not happening, this is not the thing that I want to do, and I am going to continue doing exactly what I'm doing right now, we are going to respect that. And then we're going to have to manage those expectations on the back end with the caller and with other community members. And that's where, we're respecting everybody's choice, in that we are also not telling the community member, no, you cannot call the police. They have to make their own choices. What we can do is say what we can offer, and be persistent and kind about it, but really recognize what our limits are.
Yeah, finding the right fit, finding the right person with the right approach is really an essential part of this. So just for a last question for the day, and we'll make it a spiritual one. A lot of the things that you've been talking about really require, what you described earlier as grace, the ability to persevere, the ability to not take things personally, the ability to be generous, the ability to see things from the other person's point of view. How do you've been doing this a while, how are you maintaining this in your own life and in your own workspace?
Yeah, I think what is so powerful about this work at the intersection at where we are working, where we're sitting, is that we are doing very practical work every day, right? Of providing a respite to somebody, of interacting with a person who has been potentially stepped over, has been disrespected, has been completely ignored. That in the day-to-day, we are doing the work of just connecting with people, and in really measurable, concrete ways, expanding their options and showing care. So that work feels so concrete, and at the same time, as we are doing that, we are sort of building the evidence for a different kind of world, a different way of being in community with a wide variety of people. And then we're using it. For me, I think it would be difficult if we just continued to just go out there every day and it was this work of just trying to stop the bleeding, if you will, right? I think what is really affirming about the work, and what gives me energy, is being able to then really bring that into policy conversations, to be able to go to our county officials, to go to our city officials and say, we need things to operate differently so that this is not what so that we can live in a different community, right, where people actually have what they need. And I think that's really the work of it, is that we can't just operate within the systems that we know are harming people. We have to actually put our shoulder to the work of changing those systems directly. And I think that is where we try and stay, in that intersection of doing the work and also changing the systems.
Well, Moki, this has been really wonderful. I admire you. I love what you're doing. I'm coming to Atlanta to go walk the streets with you. And I wonder if you're willing to correspond with people who are listening today, and because we've got a lot of people all over this country who are wanting to do something like what you're doing.
Mm-hmm. Yeah, absolutely. Absolutely. And I will say, we have been building our model and what we do every day with the support of so many people around the country, people who were very generous with sending us their protocol or, things like that. So we're happy to pass that on. We absolutely
name some of those.
What's that?
Name some of those agencies that have been helping you. Someone was asking about Seattle.
Mm-hmm. Yeah, so I will say, certainly, as I mentioned, Cahoots has been a beautiful model for us to look at. The city of Albuquerque and what they're doing, I think, has a lot, has really some interesting lessons to share, and will continue to. The work that originally started as the Seattle law enforcement assisted diversion work, but has now expanded to let everyone advance with dignity and co-lead. I think that work is very, very interesting and smartly done. And I will say also, the work of Mental Health First in Oakland, I think, has a lot of important lessons to offer. And then I'm really interested in the work that's happening in Durham right now around their Department of Community Safety and how they're sort of building out what community response would look like. And I think, there's many others that are perhaps smaller, that for folks that are doing this planning work, I think it's really, really important to engage people in the local community to say, what are the small grassroots efforts that are happening? Who are the people that are loudest about the issues with policing? Those are the folks that you want in the room to help design what this would look like, So please, feel free to reach out to us. I'm sure Claire is dropping our information in the chat. We're happy to share more with y'all, and also happy to host when we're a little bit further outside of COVID times, but happy to host folks to come spend some time with us and our team. But I really appreciate the opportunity to get to share.
Thank you, Moki. We'll be in touch.
Awesome. Thanks.